themselves or know someone who used prescription drugs? Okay. So as we see here, it's not surprising that at least some of us know someone or of someone who used prescription drugs. It states, as it says here, nearly 70% of Americans are on at least one prescription drug, and more than half take two. These are common ones: antibiotics, antidepressants, and painkiller opioids. Unfortunately, as much good as some of these medications do, there's also some negative ramifications of these use of pharmaceuticals as well. As we list here, drug-related deaths have more than doubled since 2000. In 2015, one person was reported to die every 19 minutes from these drugs. I personally have become more interested in this subject since I started taking my upper division requirement classes. I started to learn more about these drugs prescribed and the patient side effects therein. Therefore, I want to discuss a little bit more about prescription drugs, some information to be aware of. First, I will talk about how drugs are prescribed. Then I will discuss how people are affected by these drugs. And finally, I will look at some of the FDA ethical considerations therein. First, my main topic, let's discuss how drugs are prescribed. Doctors, no offense to them, are practitioners. They practice medicine. They don't always have a concrete diagnosis, and sometimes there may be differences between patients. Meaning when someone you encounter medically meet a specific requirement or for symptoms they present to the doctor, they have a list of things they can diagnose them with. In psychology, we go by the DSM-5, and it's supposedly our Bible, and you go by that and look at your client and to see which bubble they fit into. Then there's usually a prescription or suggestion on how to address whatever symptoms are present at that time. These prescriptions are sold to doctors using a targeting sales practice by pharmaceutical sales reps. These salespeople cater their products to the physicians and get medications into pharmacies. Oftentimes, these medications are hyped up with a sale-like price and coupon-like deals, according to Hidesh Bhushan, businessman and entrepreneur who created Marketing 91. Bhushan continues, if the doctor is convinced, he starts prescribing this product. While the convincing takes place in the clinic, the sale happens at the pharmacy. These drugs being sold usually affect each person in a different way, and we are going to look at them now with my second point. There are usually a long list of side effects. As you see here, I did the website, the medications website, their own medicine. Usually you get grabbed by these things, the sales, but if you look at these little links they provide, there's a 24-page list of symptoms that they may have that can happen with the use of these drugs. So let's see. While most major causes of preventable deaths are declining, those from prescription drugs are increasing. That's why when things look, if you can see it here, it may increase thoughts about suicide or dying, attempts to commit suicide, and worsening depression. That's things to be considered because usually there's been an indication that these things may happen or have happened. Something to remember would be that there are people who profit off the sale of these medications, which leads me to my third point. This is the drug company, the pharmaceutical company from the before mentioned medication. As you can see, their profits range anywhere from between $100 to $500 million. Therefore, someone is making money, and these same people making money fund the research to get the product to market. This may look a little crazy in this next one. There's a lot going on, but first, again, it's the same medication, but these companies have a detailed list and plan and implementation they utilize before even getting the sale of these drugs to market and stuff. They want these things to increase when you want your symptoms to decrease and the issue to be resolved. This leads me to my third main point. These trials that take place are not with bias. These are a means to a business end. But, let's see. What's my place? While the requirements during clinical trials are often done on healthy patients, they're often sold to patients who are often more elderly or not in the same physical condition as those that they are being sold to. Usually people taking these medications can't run or walk the way you would consider a healthy person do. So that, technically speaking, they wouldn't know the real effects it would have on the people who would be using the medications. These 3 points are only a portion of what you can understand about prescription drugs. But now I can begin concluding my speech. First, I talked about how drugs are prescribed based on a criterion of symptoms, not necessarily a concrete diagnosis. Then I discussed the effects of these medications and spoke about the audience relevance. Last but not least, I would say forewarned is forearmed. To be prepared is half the victory. So I would hope that I have informed you in some way of what to consider or pay attention to regarding these drugs, and thank you for your time.